Good morning. Today we'll be talking about Widal test, popularly known as Widal test in Nigeria. It's a test used to screen for typhoid fever. Notice the word screen for typhoid fever, not to diagnose. So you see the difference there. So for you to see that the Widal test or the Widal test is irrelevant or is of no use, is very big ambiguity that you have to look into. So it is a test you use to screen for antibodies produced by organism causing typhoid fever, the Salmonella species. We have so many species, but basically we screen for the presence of antibodies to the somatic antigens or the flagellar antigens. So, and the presence of either somatic antigens or flagellar antigens is to indicate either a recent infection or a previous infection that is occurring. For you to have a high titer of somatic antigen, it indicates a recent infection. So while for flagellar antigen, usually represented by age, is a recurring infection, maybe not well treated typhoid infection, although there are usually many cross reactions since it's a bacterial infection. So you might have other bacterium that causes a cross reactivities based on the fact that they might have similar antigens. So they were able to elicit an antibody that is similar. So once you carry out this test, you have that cross reactivity, and the Widal test becomes positive. That is false positive reaction. Well, it's not too bad. So if you are having a bacterial infection and the Widal test is showing it, so it is good, and they will treat you for it. So the only drawback you get from typhoid test is you might not be able to isolate the organism and do antimicrobial sensitivity on it. So that will invariably lead to wrong choice of antibiotics and the use of the wrong choice of antibiotics, which can lead to antimicrobial resistivity. So we have different methods of running typhoid test. I would have the slide method, which means you just add the sample, the serum, and the antigens, the febrile antigen, and you mix and rock for 1 minute. You get your result. As long as you are, or you know what you are doing, it shouldn't be more than 1 minute. So in a case where you begin to have rock more than 1 minute, you have a false positive reaction in the process. Then we'll have the tube method, which will take up to 24 hours to read the result. And based on the fact that this is just a screening test, so most patients, almost doctors, might not be willing to wait for that 24 hours for the test result to be ready in order to effect treatment on the patient. So the need for the slide agglutination test, which is just meant to screen the patient for whatever treatment modality will be given to the patient. Then we have other gold standard. So the gold standard basically depends on the sample and the numbers of days that the test can take. Then we have the use of blood culture, we have bone marrow aspirate culture, we have stool culture, we also have urine culture. All these take more days to achieve, and most doctors or patients will not be willing to wait for such hours. So that is why this screening test is also good. It is just a screening test, so it is not diagnostic. So what most clinicians does is they will use it as a basis, then they will now request for the longer test that would mean isolating the organism, which will take more days. So today we'll be demonstrating the tube test. In the tube test, this test takes 24 hours for results to be released. So now you see in the tube test, I have my tubes arranged. I have the febrile antigen. I have the serum sample from the patient. Then I have my normal saline. Then my tube, pipette tube rack. Now in running tube test, today I'll be demonstrating the somatic antigen for the S typhi and the flagellar antigen S typhi H and S typhi O. So that is what I will be demonstrating. Now your tube, that means I have two sets of tubes arranged for the somatic, for the flagellar antigen. Now the first tubes will contain 1.9 ml of normal saline, while all other tubes contains 1 ml of normal saline. Then to the first tube, I will add 100 microliter of patient serum. That will make it 2 ml before carrying out serial dilution of the sample. So in tube method, it is a serial dilution method whereby you begin to look for the titer. The titer is the highest dilution whereby there is an agglutination, a visible agglutination. That is the titer of the test. So in this tube now, this is 1.9 ml of normal saline. This also is 1.9 ml of normal saline. I'm going to add 100 microliter each of the serum sample to these first tubes before proceeding to diluting the samples. So just first 100 microliter. Yes. Microliter. So I'll mix also. Now the next thing is to run serial dilution of the sample. I run serial dilution of the sample. So I'll mix this. I'll take 1 ml from this tube, transfer to the next tube, mix, take 1 ml, transfer to the next tube. In the last tube, I will discard 1 ml of the sample. So this is 1 ml going to the next tube. I'll mix, take 1 ml to the next tube. I'll mix, take 1 tube. So you can decide to mix with your pipette. Then mix. Then I'll take 1 ml and discard. So this one goes. So the other set, this, I'll take 1 ml. To the next. So on this, to the next. Then in the last tube, after mixing, what will I do? I'll discard exactly 1 ml so that all tubes becomes 1 ml. All tube becomes 1 ml. So now the next thing is to add your febrile antigen to all the tubes. Then you mix and incubate for 24 hours. So this is the somatic antigen S-typhi-O. S-typhi-O. So I'm putting drop in all the tubes. S-typhi-H. 1 drop in all the tube. The same goes to the paratyphi. So if I'm running dilution, I will arrange test tubes that correspond with them also, just like I did for the O and the H antigen. So after this, you mix you plug the mouth and incubate for 24 hours. Following our discussion yesterday, talking about the tube test for Widal diagnosis, we said that it's a test that takes up to 24 hours to run. So today we have completed the 24 hours of incubation, and now it is time to read the result. Remember, it is a serial dilution process that involves diluting the sample and adding the febrile antigen to the diluted sample. So we have 1 in 20, 1 in 40, 1 in 80, 1 in 160, 1 in 320, the other like that. And we talked about the titer, that it is that value, that titration, that dilution that gives the highest dilution that gives visible agglutination. That is the titer of that sample. So today we are reading the test result by checking our agglutination against a white background. Now we're going to start with paratyphi. Looking at it closely, there is agglutination. I think you see it. But there's a visible agglutination here. It's 1 in 40, 1 in 20. Yeah, there's agglutination also. And second tube is 1 in 40. And look at it. You see an agglutination there. See at the bottom, a button formed at the bottom. That's agglutination. Then we have, that's 1 in 180. This 1 in 60. There's an agglutination there. So if you shake, see, it's agglutination. So then remember, you have to wait for 24 hours to read the result. You have to wait for 24 hours. So this is 1 in 360, and there's still agglutination. So the titer of this particular one is 1 in 360. So let's go with the H antigen now. This is a bit mild agglutination there. The agglutination here is not as visible as that of can see agglutination. So as that of the O antigen. So have agglutination there. And you have this agglutination. Then there's agglutination also here in this tube. So, get it. So that is how to read the tube test result. So there's agglutination in all of this tube. So it is positive for typhoid fever. So you need to report your result so that treatment will be inferred on the patient. Thank you. We'll meet next time. Yeah, to have a blessed day. Thank you.